Hello, everyone. Thank you for joining us here. We're just going to give everybody who's trying to come in here just a couple more minutes, so hang tight with us, and we'll be back shortly. All right, everybody. Good afternoon. My name is Kyle Stupai. I'm a physical therapist and clinical director here at Spear Physical and Occupational Therapy. I want to welcome back those of you who have attended one of our other webinars here, as well as those of you joining us for the first time. Thank you all for choosing to spend the next hour or so with us. We hope you enjoy the time, and we appreciate you being here. For those of you who don't know who we are, Spear, we're a private outpatient physical therapy practice that's been around in the New York City metro area for over 20 years. We've continued to offer our in-person services as well as telehealth services throughout the COVID pandemic, and are doing everything we can within CDC guidelines to ensure the health and safety of everyone in our clinics, staff and patients alike. For more detailed information on our services, please visit our website at spearcenter.com. As we've slowly begun to return to our pre-pandemic activities over the last several months, we've had a lot of people reach out to us and coming into our offices asking questions about running and injuries related to that as we all get back out on the paths and on the trails and on the streets. Our team of therapists and coaches got together and we agreed that given today's circumstances, it would be a great idea to talk about some of that stuff and to answer some questions from you guys as it pertains to running related injuries. So we've created today's talk specifically with you in mind, and we're coming to you live from our own homes and offices. We don't anticipate any technical issues today, but please be patient with us as we navigate through the technology here with the Zoom and YouTube platforms. As a part of our session, we'll be demonstrating some exercises. We look forward to you following along and participating. This will not be like your other Zoom meetings you had today. We're going to have some fun. We're going to get up and we're going to get moving here. Please note that if you have any pain while performing any of these exercises that we demonstrate for you, please stop, reach out to us directly so we can be there to support you. Throughout the webinar, we want to hear from you. We want to hear any questions that you have, any comments as it pertains to some of the slides that we'll be talking about. Please feel free to let us know your thoughts in the Q&A feature. We won't be checking the comments feature, so please feel free to use the Q&A. It's at the bottom of your screen. If you hover around, you'll see the Q&A option. That's where you'll be able to get in touch with us. If you have anything along the way, please feel free and ask, and we'll save some time at the end to get to all your questions. In addition to that, we're going to have multiple speakers on at different times throughout. So if you look in the top right-hand corner of the Zoom, you'll see speaker view or gallery view. Please select gallery view. That way you'll be able to see all of us at the right time. For those of you looking at us on YouTube Live, thanks for joining. We're going to be monitoring the comment section on YouTube. So if you have any questions on there, please feel free and type it up for us. All right, so let's get into it. Let's start talking about our goals for today and some of the information we'll be covering. So we're going to go through some common injuries for runners, things that we see in our clinics on a pretty typical daily basis. We'll go through some pain prevention exercises to help if you have any bumps or bruises. We'll go over running form and biomechanics for running to make you guys more efficient and better runners. And of course, ways to prevent injuries. And again, we'll answer some of your questions that you guys have at the end of the broadcast here. All right, so we're going to introduce our team of panelists that we'll have here today. First, we have Cristina Martello from our West 67th Street office.
Hey, everyone.
We have Andy Pakter from our 95 Chambers Street office in Tribeca.
Hey.
And Mike Virgil, who's from our Union Square office, will be helping answer some of our questions on the background as well.
Hey, everybody.
All right, Mike and I are going to say goodbye for now, and we'll let Andy and Cristina take it from here.
All right, welcome again, everyone. So we're going to go ahead and get started here. As physical therapists, it's our job to identify a lot of foundational imbalances and dysfunctional movement patterns that you all might be experiencing that could cause pain or discomfort throughout your daily movements. So today we're going to focus on those impairments and injuries that are specifically related to running and when they might occur as you're running. So what we're going to do is start off with a dynamic warm-up, and we're going to have Andy kick that off just like we would want you all to do prior to going out for a run. So join with us, stand up, and let's get started.
Yeah, so like Christina said, we're going to go through a lot of exercises in this webinar. And just like running, you want to make sure to warm up thoroughly. Dynamic stretches won't decrease injury rate, but they'll help you improve performance when done correctly. Dynamic stretches prime muscles for movement. So the first one, so we're all going to stand on up. Christina's going to do them with me. The first one, we're going to do our scoops for our hamstrings. So I'm going to bring my right leg forward. And then I'm going to scoop under my foot as my ankle comes up. And then I'm going to switch legs, scoop underneath. And you should just feel a mild to moderate stretch. If we wanted to advance this, we do something called the toy soldier. So I come up a little bit taller, and now I'm going to kick to the opposite arm. What's super important is that I keep my back nice and straight.
Feels good.
Mild to moderate stretch. The next one we're going to do is for our hip flexors. So I'm going to take a little bit of a lunge. My right leg is going to be back. My left leg is going to be forward. I want to make sure that my knee is not over my toes. I'm in line with my toes. And then if I'm reaching my right leg back, I'm going to reach over with my right arm. And I should feel a stretch in my right hip. And then I'll switch sides. And if it's too much getting into like this lunge position, we can do like these curtsy lunges. And I should feel the same stretch.
Feels nice. I needed this today.
I It should feel good after sitting all day. All right, so the next one we're gonna do are inchworms. So I'll bring it to the floor here. And I'm gonna go almost into like a downward dog position. I'm gonna walk my hands forward until I get into a plank. I'm gonna tighten my stomach and I'm gonna walk my heels up. I wanna keep my knees nice and straight. And once I feel like I can't straighten my legs anymore, then I'm gonna walk forward.
Nice job.
Okay, so now that we feel like we warmed up in a general way, Christina's gonna show us a couple of warm-ups specifically for runners.
Okay, so the next two warm-ups are a little bit more dynamic. They're gonna get your heart rate pumping a little bit. So what you should do is just start by jumping in place. And as you're jumping in place, you're gonna now lift one knee up in the air. And then you're gonna go ahead and just alternate. And this essentially is putting you in a running position. So you keep jumping there. Nice. And then the final one is going to be the same exact position, except we're going to get a little bit more of the hamstrings, just like Andy showed us before. So you keep that jump, and now you're extending your knee all the way. So you're getting a nice cycle, and you could move forward and really get the heart rate up. Beautiful. Looks good. Okay. So now that we've got our hearts racing a little bit, we're going to catch our breath, and then we're going to start talking about some injuries that we might be seeing. So what we're going to do is start from the top of the chain down. And what I mean by that is the hip. The hip is very common to have a lot of injuries, and it's very important as a runner for foundational strength, stability, power, and mobility. So we want to think about the hip as if there are impairments that are happening at the hip, we can then get injury down the chain. A lot of this comes from overuse, and some of the muscles that we will see are overused are the hip flexor, the glute medius, and then we also might see some inflammation to the bursa. So some things you might be feeling as you're running are pain at the front of your hip, the side of your hip, and also some tenderness when you might be lying on the right side. These injuries, again, like I said, are caused from overuse. And that happens because we're often doing a repetitive cyclical motion. Now we're going to bump down to the knee, which is the next joint on the chain. And some common injuries that we're going to be seeing include patellofemoral pain, patellar chondromalacia, and IT band syndrome. Now it's important to remember that impairments or injuries that might be occurring at the hip might not actually mean that something's necessarily wrong at the hip. But in fact, there might be something going on at the top of the chain or at the bottom of the chain. So that might mean the hip or the ankle. So we want to make sure that the knee is able to follow in stride with the other joints. This way we don't feel direct knee pain when you are running. Chondromalacia might be telling us that there's some decreased cartilage to the joint. The common runner's knee might have you feel some pain to the front and the medial aspect or the inner aspect of your knee. And then the meniscal or ligamentous tears, we might not be seeing as common because those occur more with impact, but they're not completely impossible when you are running. So what we're going to do now is have Andy come back in, and we're going to demonstrate exercises that are targeted both at the hip and the knee. And we want to do these to help us prevent any of the injuries that we might be seeing. So the first thing Andy is going to do is lie flat on the treatment table. So you all could join with us, and you might be doing this on a couch or a bed. He's going to engage his core nice and tight, so he's flattening out the spine. And as he's doing that, he's going to lift his right knee up and then cycle his hip down. So if you're all doing this, you'll feel that sometimes your core wants to disengage, and you might have a compensation at the low back. But what we want to do is engage the core as you're using your hip flexor. This way you're better trained to engage the core as you're running in an upright position. Beautiful. The next exercise that would be targeting the glute medius tendonitis or the hip abductor is going to be a hip hike. So what Andy can do is either step up on a stool or he can stay flat-footed.
Well, I got a better stool.
We have to shift up the camera a smidge. There we go. And you all at home could either use a step or a stack of books, throw it on the floor. So you're going to step up onto that stool. Andy's left leg is just hanging out. It's not really doing too much. With his right leg, he's going to be squeezing that glute medius, the abductor, which will then naturally and relatively elevate his left hip. So if you're all doing this correctly, what you should feel is an immediate burn or activation on the side of your right hip. And that will tell you that you're appropriately using the abductor to stabilize your whole leg when you're running, because you're always running on one leg. We never have 2 feet touching the ground when we're running. So this is a very important foundational exercise. The last exercise for the hip is going to be called the stork. Not sure why it's called that, probably because we're standing on one leg and we look like a stork. So Andy's going to be nice, flat up against the wall. He's going to be on his left leg. The right knee, he's pressing actively into the wall. And as he's pressing, he'll feel both of his hips kind of turn on, those muscles. And what he can either do is just statically press for a count of 5 to 10 seconds, or he can then add a trunk forward flexion. So he can lean forward while pressing his hips back towards the wall. And that will increasingly activate the glute muscles. So again, if you're all joining along and doing this at home, you should feel burning at both of the hips, even though it seems like you're not doing too much motion. Beautiful. The next set of exercises are going to be focused a little bit more at the knee injuries that we reviewed. So I'm going to make Andy do his favorite of all time, the wall squat, just like a drill sergeant. He's going to have his back nice and flush against the wall, core is engaged. He drops down so that his thighs are about parallel to the floor. And he could hold that for a count of 30 seconds, maybe 2 or 3 times, okay? We're primarily activating his quads. Now, to progress this and activate those inner quad muscles to prevent some patellofemoral pain, we want to put a ball in between the knees, and what you can do there is give a little squeeze. So this is targeting any imbalance we might have in the quadriceps muscle and making sure that our patella will always be tracking properly when we're running. Beautiful. And to really show off how strong Andy is, then he could also remove the ball and lift one leg and do a single leg squat. Woo-wee. Beautiful. And the whole time you want to make sure there's no compensations, your hips are level and your core is nice and engaged. Nice. All right, good job. The next exercise we're going to be showing is similar to a single leg squat, or we call it a lateral step down. So just we had Andy doing before where he was up on the stool, he's going to jump right up there again. And what he's essentially doing is performing a single leg squat. So we'll see a dip of the knee. Looks good. We'll see a dip of the knee as he's pushing his hips back towards the wall. And this is helping again to stabilize, to activate the quadricep muscle as well as the hip abductor. So we don't get what we call is a knee valgus when you're running, which is when the knee is caving inward. Beautiful.
Cool.
And then,
Out of breath.
good job. You're doing a great job. Now what we're going to do is move on to some other injuries that we might see lower in the chain. So Andy's going to talk to you about those.
Yeah, so Christina's going to go away. We're going to bring up the PowerPoint again. Now that I'm out of breath, we're going to focus on some lower leg injuries. So as you can see from the picture, here are some lower leg injuries. They might occur from repetitive training errors or muscle imbalances that we previously reflected on. Like Christina talked about, whatever your knee and ankle is really doing what your hip is telling it to do and what your ground's telling it to do. So sometimes people may develop shin splints or medial tibialis stress syndrome. Stress fractures might occur at different sites, like the leg bone, the tibia, or it might happen in the shin bone. It might happen in the calcaneus, which is also called the heel bone, or the metatarsals, the long bones that branch out into your toes. Some runners may develop tendonitis, like an Achilles strain, but it could also develop tendonitis on the outside of your ankle or your fibulari or peroneal tendonitis. Tibialis posterior happens on the inside of your ankle. These problems usually occur to weakness and tightness in the calf, but could also be affected by things that are happening above the chain. So we're going to go over some lower leg, or we're going to go over some ankle and foot stuff if we go on to the next slide, and then we're going to go over some exercises. So there you can see in the foot, let's look at some common injuries a little bit lower down the leg at the ankle and foot. There's plantar fasciitis, very common in people who pronate a lot. A second common injury are ankle sprains, which instead of the tendonitis we talked about occur in the ligaments. The last common injury is hallux rigidus, which is just like stiffness in your big toe that can cause some pain, limit range of motion. But I think it's super important to say that because these injuries mimic each other, you want to make sure that you would contact a doctor before you progress your exercises or really get evaluated by us. So we're going to have Cristina come on back. We're going to go over some single leg stance variations. Each time you take a step when you run, it's single leg stance. And if you're having trouble below the chain, things above it are affected. So the first thing we're going to do is a single leg stance. So
and
just working on our balance.
I want to pause you 1 second, guys. A couple of people have been asking about how to see Cristina while Andy's talking. Just switch to gallery view in your top right corner real fast. So if anybody's watching and can't see Cristina, I'll butt back out. Sorry.
Yeah, so hopefully everyone can see us. We're going to be going over some exercises. So the first one is for single leg stance. Like I said, super important for all us runners. So if she's going to stand on her left leg, now we want to bring her right leg out to the side. That's flexion, that's abduction, and then back would be extension. So let's first do flexion. And you should feel like how the leg that's being stood upon is moving a little bit and you're perturbating yourself. So if you bring it out to the side, out to the front, you should feel like your ankle's really, really working.
Yeah.
Sometimes people use this as a warm up. Sometimes it's a good exercise if you really want to fatigue yourself. We can make it a little bit harder if she puts a band around her ankles. Now the leg that's standing, we should feel the ankle, and the leg that's moving, you should feel like your hip and core are doing a lot. So if she's out to the side, she should feel her glute. If she's in the back, she should feel her stomach and her butt. And see how she's not wobbling side to side. That would be incorrect. The next one we're gonna do is for ankle mobility. So we talked about a little about plantar fasciitis. If your ankle doesn't move, your forefoot has to move too much, and then people stretch their plantar fascia underneath. So if we can mobilize our ankles, we can move a lot better up and down the chain. So the first one she's going to do is she's going to keep her foot planted, make sure her heel's on the ground, and she's going to lean her knee over her toes. And sometimes people might have kneecap pain with this one, and I would say just maybe not do it. There's plenty of other good exercises and ways to strengthen or stretch your calf out. So she's going to lean forward. She should feel like maybe some tension in her Achilles or in the front of her ankle. It should be mild to moderate. And then she's going to go over the inside of her foot. And then you can see her foot pronates. Pronation is super important for mid stance when your feet are right underneath you during that run. And then she can bring her knee to the outside. That would work on supination, which is super important for right before you push and leave that leg on the ground. And we can make it a little bit more of a stretch by putting a band in the front of her ankle. And you just get like a little bit of tension on it. You lean forward. Your talus bone, the bone that sits in the middle of your tib fib, it has to move backwards in the direction it's pulling in order for you to get dorsiflexion. So sometimes people have pain when she did the first exercise, and this might take it away a little bit. But same thing, it should just be mild to moderate, not a whole lot of pain. The next one we're gonna do is toe yoga, and I'm gonna do it with Christina because it's super hard. And hopefully everyone appreciates that I was doing all my exercises with dress shoes on. Okay, so the first one, it's much better to do this in standing because like we're trying to increase all those proprioception and strengthening, then we want to make sure that our feet are in a position that is similar to running. So the first one we're going to do is we're going to lift our big toe up. We're going to leave all our toes down. I don't want to grip with my toes that are down. I'm just trying to lift up. Then I would leave my big toe down and lift all my toes up. And same thing, I'm not gripping with my big toe as I do it. Then I'm going to lift all my toes up and try to get my big toe down, my middle toes down, and then my pinky toe down. And then all of my toes up, pinky toe, middle toes, big toe. The last one is for the arch in your foot. So you're gonna raise up towards the ceiling, creating that arch in your foot, but I don't wanna grip with my toes. So let's go through it one more time. Okay, big toe up. All your toes up except for your big toe. All your toes up. Big toe, middle toes, pinky toe. All your toes up, pinky toe, middle toes, big toes. And then the last one, doming. So I'm reaching up towards the ceiling. Okay, great. Hopefully everyone feels a burn in the bottom of the foot. Maybe you don't get a whole lot of throughout the day. So I'm gonna send Christina away one more time. We'll bring up the slide. And then we're gonna talk about lumbar strains real quick. So your core is basically your diaphragm on top, your abdominals in the front, the sides and back, your pelvic floor on the bottom, and then tympani, your rotators, your paraspinals on the back. If these muscles can't stabilize when you run, you're gonna load your spine, and then eventually the loading of your spine might result in a failure and might cause some of the back pain that people have. So Christina's gonna come on back one more time. And then we're gonna go over some exercises for our core. So she's gonna go ahead and lay on her back, but you could realistically do this exercise anywhere, just sitting at your desk if you are. So all we're trying to do is engage our core. Some people have trouble engaging their core, so sometimes what we do is we tell people to push their backs into the ground. And you're trying to squeeze your stomach, but you're not trying to hold your breath. So if you can, hold your stomach tight, breathe in through your nose, and then out through your mouth while you hold a tight contraction, while you feel a contraction underneath your fingers. The next one are marches. So she's gonna bring her leg into tabletop. And now she's gonna perform that same abdominal contraction. And now she's gonna drop one foot to the ground and then back up and then slowly switch. And she's showing you that she has like no space in there. Her stomach's tight, she has good breathing. She does it perfect. Next would be dead bugs. So now you're doing exactly where she's doing, but now we're adding a different element to it. So our arms are moving. Think like you're running. It's not just moving your legs. There's things that happen above the chain. So now as she brings her left leg down, she's gonna bring her right arm overhead. And same thing, she's gonna feel like her stomach is really, really helping her and her back is nice and neutral. We can make this a little bit harder by adding a band to her ankles. So like she tortured me, I gotta torture her for a little bit. But we do this to our patients anyway, so we deserve it sometimes too.
Nice.
Okay, so the last variation is bird dogs.
This one I'll wobble.
She's gonna go on her hands and knees, hands right underneath her shoulders, her knees right underneath her hips. She's gonna squeeze her stomach before you move. And then as you kick back, you're gonna feel like your glutes engage. And then as you reach up with the opposite arm, you wanna make sure that your neck's nice and relaxed. The hand that's in the floor is pushing real hard. It'll help you engage your core. And you should feel like everything's working, just like when you run.
Yes, sir.
So we're going to send Cristina away, and we're talking a little bit about the elements of running. So if you're an existing patient, then you should ask your therapist about these different elements of running. But if you're a prospective new patient, then checking our website for clinics who have therapists with running experience, like me and Cristina, we can help individual across training and manual correction rehab. So we're going to take away the slide again, because I want to show with Cristina some of the elements of running. So she's going to kind of like show you the good and the bad that we see when we do our running analysis. The first is vertical displacement. So it's how high your waist or your head moves up and down. So Cristina is going to show someone who has going to demonstrate someone who has like a very high vertical displacement. So these people like bound. And now you're thinking that equal and opposite force, how much force is getting put from the floor up the chain at your ankle, your knee, your hip, your low back, versus someone with like a low vertical displacement. The ground almost helps them in the direction they're moving. The next one is step length. So it's how far your foot travels in front of you or underneath you. So let's say someone who has a big step, now she takes that big step, and now the floor is pushing her in the opposite direction she's going, that equal and opposite force. But if she takes a small step length, now the floor is helping her go in the direction she's going. That equal and opposite force from the floor is pushing her in the direction she's going. The last thing we're going to talk about is foot strike. People like usually like give maybe someone who's a heel strike or rear strikes like a bad name, but if it's been working for you, you do not want to change it. So she'll demonstrate someone who lands on their heel. The next one would be someone who lands like midfoot. And then the last one would be someone who toe strikes. But like I said, like no matter which running style you have, you really want to make sure that you're facilitating that. New runners end up with more injuries. So when you start transitioning to a different like foot strike, you're almost like starting all over with that neuromuscular connection. So Christina's going to talk a little bit about injury prevention. I'm going to go away.
Beautiful. Thanks, Andy. And feel free to comment about any questions for the running biomechanics. We often get a lot of them. Very individualized, just like Andy was talking about, but we can definitely answer some questions generally. So the last thing we're going to talk about are just a couple of tips for preventing injury while you might be in your training program. The first thing we look at is a controlled mileage increase. Our general rule of thumb is that you don't want to increase more than 10% of your mileage per week. But that really is more geared towards if you're running maybe upwards of 30 or 40 miles a week that not everyone might be doing. So if you're increasing your mileage 2 or 3 miles, and that might be a 10% increase for you, that's totally fine. You just don't want to do something very drastic where you might not feel the effects of it until a few weeks later. The next thing you want to do is vary your terrain. So what does that mean? Most of us are running outside. Some people are accustomed to running on a treadmill, but regardless, you never want to do just one of the same thing over and over and over. You want to try to get yourself either on a nice dirt or trail surface for a couple of runs. You might also want to try some grass running, or even if you have to mix it up with concrete. Regardless, never do just one thing all the time. If a lot of you are based out of Manhattan, I often find that running around the reservoir is one of my favorite things to do because it's a nice soft surface and it's not too much impact on the feet. Next, you want to keep an up-to-date sneaker. So again, our general rule of thumb is that we don't want to have more than 350 miles per pair of sneaker, but we might not all be counting that. The biggest tell about if you need a new sneaker is the wear pattern. So you want to look at the base of your shoe. A lot of us will have wear patterns where we strike the hardest or where we wind up putting a lot of our pressure. So if you see a part of the shoe that has completely no treads or tracks left on it, that's a good idea to look into a new shoe. Lastly, you want to put focus and energy into your recovery and your resistance training. Now, a lot of people have been saying, well, I can't really do resistance training. Gyms are closed lately. But resistance training also includes a lot of exercises and the dynamic training that we showed you here today. So you always want to make sure either before or after your run, you're putting in a little warm-up time, you're putting in a little stretch time afterwards, and then try a couple of different exercise routines during the week, like maybe some strength and HIIT training, yoga, Pilates, etc. And with that being said, we're going to go ahead and turn it over to some questions. So we've been polling your questions as we've gone throughout the presentation. So we're going to go ahead and get to a few of those.
All right, great job, guys. That was super informative. Love the slides and the exercises. And we got some questions ready to go here. First things first, got a question about some Achilles pain. People having Achilles pain as they begin running again for the first time. To the both of you guys, I'll start with you, Cristina. What do you do for Achilles pain if you start to have it when you're starting to run again?
So Achilles pain is a little bit tricky. We often find that it can advance pretty quickly if you're not keeping an eye on it. And what I often advise my runners to do is to take a small period of rest. I know that no one wants to hear take rest for 2 weeks. I just started my program again. But with the Achilles, the inflammation happens hard and fast. So if you don't take a little bit of time to reduce that direct jumping impact on a run and focus on stretching for a little bit, we might be putting ourselves in a worse situation. So when you first start to feel the pain, really focus on stretching out your calves as well as the anterior or the front aspect of your ankles. We could, come see one of us and we could always talk you through a few of those exercises and stretches. But put a lot of focus on the beginning with your calf stretching. Check your shoes because you might not have enough support in them. And then you want to really focus on a gradual return, not doing too much too fast.
Yeah, Kyle, did you say that this person was like a new runner or like they had gone back into it too soon?
They weren't super specific on the question, but just they're having Achilles pain while running and walking.
Yeah, because I think like Cristina said, sometimes people are going back like maybe a little bit too early or like doing too much too soon.
Awesome. I got another question here. Someone asking about plantar fasciitis. The doctor said it's okay to run, but sometimes it hurts, sometimes it doesn't while running. How much should someone push through that? What are the things to look for when dealing with that?
I mean, I think that like the doctor expressed like a good concern over it and said that like it's okay to run, but as long as you're not feeling your soreness while you're doing it, it's probably okay. But I think like monitoring how you're running, no one's gonna know how you're feeling except for you. So I think that just like feeling how your body's feeling during that run, seeing how it feels during previous runs or runs after that, you want to make sure you're not irritating anything. So try and take like good breaks. If it is sore, make sure to stop.
And I would add to that, Andy, as well, if you are experiencing plantar fasciitis pain, put a lot of effort into reducing the tension after you run. Not to say that you don't have to run, but when you come home, roll out the base of your foot, that bottom surface of your foot. And then you also want to make sure, again, you're stretching your calves as well as your hamstrings, because tightness of the whole back chain of your body can lead into tightness of the plantar fascia.
Awesome. I know everybody's different. Everybody's got different heights and leg lengths and all that kind of stuff. What's a general rule of thumb for stride length for runners?
There's no real specifics. There's some research that says that if you take faster or if you take smaller stride lengths, you run faster at a faster cadence, you might decrease injury rate. But we really want to stress that however you've been running, you really want to change very little. All the research is pointing towards like changing as little as you can. But I would say that if you're running and if you notice like the cadence is pretty slow, then maybe you can bump it up by like 5% and then see what that does. If it's really hard to catch up with that fast cadence, then maybe bringing it down a little bit.
And to bump off of that, what we typically look for in a cadence is, and what that means is how many steps you're taking per minute, basically. We want to generally be in the range of 170 to 180 steps per minute. With that being said, if you take more frequent steps, you might have a shorter step length, Andy was saying. Or if you take less frequent steps, you'll probably have a longer step length. But I want to totally agree with Andy in the sense that each runner is different and you don't want to make any drastic changes. But if you say time yourself and you see how many steps you might be taking in a minute, you could always take your number within that range and then reduce it or increase it by the 5%. But again, that is something that we would advise for you to come see one of us, because that's a change we would want to make only after you've tried every other type of treatment of physical therapy and stretching and strengthening before you implement any type of change to your stride.
Awesome. Are there any, I'm sorry, what are the, because the answer is yes, we all know this. What are the common running errors that lead to hip pain?
I mean, sometimes we notice a lot when we put people on the treadmill. That's why when we put people on treadmills for running analysis, it might not always be true, but people tend to run on that tightrope where their legs come really close together. That puts a lot of stress on the outside of your legs and maybe the inside of your knee a little bit. So I think a lot of times we see maybe their hips drop when they're on the stance leg. And then sometimes they're on that really tight rope and their legs are coming real close together.
Right. So some things we would want to think about are stepping almost as if there is a line right in between your body and you want to be right on the outside of that line. Like Andy said, we don't always want to have this midline or stepping or crossover. That tends to come from a weakness at the hip abductor. So just what Andy was saying, when we see the hips drop, it's because one hip is not stabilizing you as it's in a single leg stance. So if you think about a weak hip here, then my leg is going to cross over as I'm trying to land. So my left hip is weak, my right hip's dropping, and then I'm crossing midline. So what we really want to focus on is targeting that hip abduction strength so you don't essentially have that impairment as you're running.
And plus, like people, the faster you run, the narrower the base of support will become. But like she said, like if you feel like you're not running that fast and you're crossing midline, then probably it has some tightness on the inside of your leg and weakness on the outside of your leg.
Next question about sneakers and features to look on for sneakers. What are some things that you guys recommend? Are there any that actually help to prevent injury? Are they worth the investment?
I mean, yeah, you can go ahead, Christina.
Sorry, thanks. So sneakers are always worth the investment, in my opinion. I know they can get a little pricey, but if you have a good pair that works for you, you should be able to use it for quite a long time. And everyone loves to ask this question, which sneaker should I buy that's going to prevent me from getting hurt? There is no one sneaker for every runner. It really depends on, the shape of the foot, the structure of your foot, and the type or level of support that you might need. So what you essentially want to look for in a shoe, you might see differences are a neutral stability or high stability. And again, that's something that you should really check in with a professional, either a PT, or I always advise either going to a Jackrabbit or a New Balance store, or any company brand that will have that foot plate. When you go to the store, you could test it out. Some people ask, is that gimmicky? Is it worth it? It's definitely worth it. And generally the running experts that work at those stores have a good idea of what they're talking about in terms of the stability of the shoe that you would need. And then you could always cross-reference it with us or even a podiatrist.
Yeah, I think that the only thing that's exactly what I think too about it too. The only thing is that I think the force plates, when you stand on them, that's just you standing. The elements of running can be more dynamic and you're not getting like the full picture of what's going on if you're just standing on those force plates. So I think that, definitely go to a professional and see if they can look at the way you're running and then evaluate what kind of shoe you need. Also, I think a big thing that people have difficulty with is like the shoes are expensive, so you just keep running in them. I would say that like if you have an older shoe and you're having pain, I would go to a new shoe because that old shoe is probably not doing what it was made to do. It's probably lost a lot of that stability.
Awesome. I had a couple questions come in about cross training. If you guys could talk a little bit about cross training. Someone asked specifically about HIIT classes. Then also, now that we're working a lot at home and gyms are kind of, some people are comfortable, some people aren't yet. What are some things we can do kind of around the house or things that don't require as much equipment?
Yeah, I think like some of the exercises we showed are like a great base. But when you come into physical therapy, we evaluate for all the weaknesses, range of motion deficits, and then we prescribe like a tailored exercise to you. If CrossFit seems great, the only thing is that you're going into a class that's very generalized. They haven't really developed those exercises for you. But if like you feel like those exercises are really helping you strengthen and you notice decreases in pain and you notice improvements in running form, then I think that might be a good step for you. We would help you tailor that a little bit more.
Agreed. And I also always suggest to runners not to forget about the lengthening and stretching aspect. So if you are doing HIIT exercises that might include squats or lifting weights overhead and hip strengthening, that's totally fine. We want it and we need it, but don't be afraid to do a day of yoga or Pilates, something that might help you activate your core and just return the muscles to a length that we need them to recover at.
Awesome. I had a question come through, just top 2 or 3 recommendations for hip pain while running. What to do with a stretching or an exercise to help with that.
I think before you run, I think the most important thing is to engage your abdominals, engage your glutes. There's just like a great exercise where if you stand on the stance leg and you feel your glute contract and you just do like these little steps and you feel like your butt's engaged, your core is engaged with some of the exercises we did, I think that's like an awesome warm up. And I usually that helps a lot with people who have hip pain with running.
Yeah. So to pick out just a couple of what we did, we might tell you to do the hip hikes or the 3-way into flexion, abduction, and extension. We would really know that we're activating the glutes there. And then making sure when you come home that you're going to be stretching your hip flexors and all of the posterior chain muscles.
Awesome. I got a 2 for here. I'm going to kind of combine these 2 questions into one. For people who've taken a longer hiatus from running and are just getting back into it now, and or runners who they're competitive, they do half marathons, but we're not really doing any of the marathons right now. What's your advice how to get back in the state or stay in competitive shape as we go through the COVID season?
It's hard to feel like you're staying in shape. And my first response to when my patients are coming in and they're like, I didn't hit this time for my 5K. My first disclaimer is it's not the time to be hard on yourself. But my second piece of advice is to try to keep up shorter runs that might be a little bit faster. So people are saying, well, I usually run a 10K at this rate, but I haven't run in a while and I feel like I get tired after 2 or 3 miles, right? So take a few weeks, take 2 or 3 weeks, build yourself up to these 2 or 3 miles at a slow pace. And once you feel a little bit more comfortable, what you could try is doing something that we might say is a tempo run. So, hey, I want to take 5 minutes within this 3-mile run and try to go a little bit faster. Or you could even lengthen that. Now I want to try my middle mile and try to go a little bit faster from the, out of the 3 miles, maybe I'll try to go a little faster at my middle mile. And if you do that maybe once or twice a week without really pushing yourself to the point of pain, then you should be able to feel like your cardio and your speed endurance, if that makes any sense, is building as you go.
Yeah, I was also laughing with Christina at that question because I have like so many patients in my head who do the same thing. They just like want to get back into it 100%. And that's just like a great way to get hurt. There's like this saying that you should be like fit to run and not run to be fit. There's a whole bunch of cross training that goes into all those marathon runners. And you really want to make sure that you have like this really good base before you start running at a competitive level again.
And an organized program.
Yeah.
Cool. A couple more questions here. If anybody has anything, please feel free to continue to add it to the Q&A section. Quick hitter, ice or heat?
I mean, usually it's like ice if it's achy and then like heat if it's stiff.
Yeah, so for runners, if you normally dealing with inflammation and tendinitis type issues, I would say ice. But my other disclaimer is Neither one is going to completely fix you. Ice will numb the pain and heat might make you feel a little more fluid. It's not our go-to for anything. We always want to implement the therapy and the treatment, but sometimes it's whatever helps you feel a little bit better.
Cool. All right. We'll go with one last question here. Should we change anything with our running now that it's getting colder outside?
I mean, like the warming up of things is pretty important. So if you're going into the run and you feel cold, probably it's time to like put more layers on. I would like err on the side of being too warm rather than on the side of being too cold, where you might feel a little bit stiff.
And I would also say that sometimes people feel, well, I'm going to warm up after a mile or two. I'm going to get hot. It's better to keep your muscles moist and fluid rather than feel completely stiff and put yourself really at risk for injury. But what Andy said, warm up, warm up, warm up. Do some of your dynamic movements, exercises that we taught you today, and you should be primed and ready to go.
Awesome. Well, thank you guys. That was really informative. We got through just about every question here. If we didn't get to any questions that you have, we'll have a recap that we'll have. And this is being recorded as well, which we'll post on our, I believe on our Instagram and our YouTube channel. So we'll have all that ready to go. So thank you guys. We hope everybody enjoyed today's talk and it was a valuable use of your time. And you learned a few things about running. I know I did. And some of the symptoms that you're having. If we didn't get to your question, like I said, we'll do our best to reach out to you guys directly afterwards. Here. All right, just to give you guys our contact information from the panelists who are here during the chat here. Christina, she is based out of our Upper West Side office on West 67th Street. Andy is down in Tribeca at our Chambers Street office. We'll leave their emails up for a couple seconds in case anybody wants to reach out. Email is definitely the best way to get a hold of us. We'll get back to you as soon as we possibly can here. And then also myself and Mike, we were here as well, answering on the back end with things. I'm actually located in our Westchester office over in Pleasantville, which is in the middle of the county. And Mike is down at our 14th Street Union Square office. Please feel free to reach out to any of us about anything, and we'll happily reach out to the others if we need to. So thank you guys again for joining us here. As an outpatient physical therapy practice, we treat an array of conditions from head to toe, not just runners. Should you feel that you could benefit from any one of our individualized guidance and treatments, don't hesitate to reach out to us individually at the emails we provided or down here at the website below. In addition to in-person sessions, we're also offering telehealth sessions and running analysis as well in some of our clinics. So please feel free to reach out to us. All right, guys, thank you so much for joining us today, and we'll see you guys next week.